Hi, everyone. Welcome to UHC Online Anatomy Series of the Respiratory System. Uh, so we're just going to start with the basic pathway of the respiratory system. And we move on to the next one. This is the next slide. I'm so confused. Okay. Hi. So, the respiratory system starts like you get oxygen from the air, which the air isn't just entirely oxygen, but whatever processes the body filtering. So it goes through the nose and mouth, through the pharynx, which connects it to the esophagus, which then takes it to the larynx, which is where the vocal cords are found, and into the trachea, which then takes them to the bronchi, which branch out to either lungs, and then gas exchange occurs there. And in order for the lungs to take in air, the diaphragm works through basically negative pressure by muscle contraction, making a vacuum to pull air into the lungs. And by relaxing, it pushes it back out. The gas exchange that occurs in the lungs happens at the alveoli and blood vessels of the lungs, and where oxygen diffuses through the cells, and so does carbon dioxide. Yeah, and then to go more in depth into the diaphragm, yeah. So basically, the diaphragm is just this muscle that separates the organs and the abdomen. So the abdomen is like lungs and up, organs is like everything below. It contracts and flattens out when you inhale, making the vacuum effect mentioned in the previous slide. And it can also be used to increase intra-abdominal pressure, which helps with vomiting and fecal defecation and excreting urine. And then other muscles can be used at times alongside with the diaphragm. The two circumstances most common is rigorous exercise and respiratory dysfunction, which can also just be an asthma attack. So yeah, that's the diaphragm.
Hi, everybody. This is Natalie. I'm going to talk a little bit more about the respiratory system. I hope you're all doing well. So although we're talking about the respiratory system, the heart and lungs are really, really interdependent. They depend on each other to do a lot of their functions. So together, the heart and lungs are responsible for putting oxygen into your blood and then transporting that oxygen throughout the rest of your body, which, as I'm sure you all know, is really important for us to carry out our daily functions, for all of our muscles to work, and for our organs to be able to do their jobs. So if you look on the diagram, some important structures that are connected to the heart and lungs are the pulmonary artery and the pulmonary vein. The pulmonary artery is going to be carrying blood, if you follow those arrows, from the body. It goes through the right heart, and then it travels to the lungs through the pulmonary artery, and that's going to be your deoxygenated blood, the blue blood, because it needs to go pick up oxygen in the lungs, and then it will become oxygenated and appear red, and then it travels back through the pulmonary veins, and once it travels through the pulmonary veins, it lands back into your left heart. And so from your left heart, that's the pump for your body to transport your blood throughout the rest of your body and deliver that oxygen. So if you just kind of think of overall, it goes from your right heart to your lungs, to the left heart, and then to the body. And what actually gives blood that red color is the hemoglobin in it. And we'll talk a little bit more about that in a minute, but it's a really important protein in your blood that is going to help deliver oxygen throughout your body. And if you've ever gone to the doctor's office or been in the hospital, they can actually measure the amount of oxygen that is in your blood with a pulse oximeter. And that's basically like a little clip. They usually put it on your pointer finger, and it spits out a percentage, and that percentage is telling you how much of the hemoglobin in your blood is bound to oxygen. And usually all of us breathing normal air, our oxygen saturation is about 98 or 99%. So it's really high. But when your lungs aren't working properly, or if gas exchange can't occur, if you say you have an asthma attack, or the complications that we're seeing from coronavirus can cause your saturation levels to fall. And that's going to be a really big indicator for the doctor that something in your lungs or your alveoli is not working properly. So that's what that's a measure of. And we can talk a little bit more about hemoglobin on the next slide. Hemoglobin can be pretty complicated, so I won't bore you with all of the details, but just a quick overview. If you look on the right there, that's a magnified view of a red blood cell. So hemoglobin's a really tiny protein. And like I said before, it's going to carry all the oxygen in your body, and it also carries carbon dioxide, which is pretty important. And you don't have to think too hard about that. What it's going to do, it's going to carry oxygen to your tissues, and then it's going to pick up carbon dioxide from your tissues to bring back to your lungs. And then you're going to exhale and you release all that carbon dioxide, which was made possible because the hemoglobin brought it back to your respiratory system. And so if you see here on the right, that molecule of hemoglobin, it's going to contain iron, and then a couple other protein chains that we don't have to get too detailed about. But if you think of diseases you might have heard of, there's one that's really common when you don't have enough hemoglobin, and that would be anemia. So some common examples of anemia are iron deficiency anemia. And like you can see in the diagram, iron is one of those components. So if you don't have enough iron in your blood, you're not going to be able to carry the oxygen that your body needs. Another example would be sickle cell anemia. That's when the red blood cell loses its nice round shape, and it also then can't carry oxygen like it's supposed to. So those are a few examples. If your hemoglobin levels aren't where they should be, what can happen. And then lastly, just one hemoglobin molecule, it can carry up to 4 molecules of oxygen. And there's an interesting scientific phenomenon that they talk a lot about with hemoglobin. It's called cooperative binding. And that just means that once a hemoglobin molecule starts picking up oxygen, it gets better and better at it. So that's its job, to carry around oxygen. So once it binds the first molecule, the next molecules that it binds, up to 4 molecules, it's just going to get easier and easier. And that's a good thing that we want, because we want our body to be able to deliver that oxygen for us. And I think Ravi is going to talk to you guys a little bit more about the lungs themselves.
Yeah, so now we can talk a little bit more about the actual anatomy of the lungs. So, you have 2 lungs, a left lung and a right lung. And then each lung is made up of a different number of lobes. The right lung is made up of 3 lobes, and the left lung is made of 2 lobes. And the reason that your left lung has only 2 lobes is because the heart sits on the left side. So you want to create enough space for the heart to contract. That's why the left lung only has 2 lobes. You can kind of see the lobes like when you take an X-ray. Sometimes, people will get like a pneumonia, and a pneumonia is just an infection of your lungs. So on an X-ray, sometimes you can tell actually what lobe is affected too. That's a nice little tie-in. And the lungs themselves aren't hollow. They're composed of sponge-like tissue, and we'll talk more about this on the next slide. But the lungs are composed of alveoli, which are tiny grape-like sacs, basically, that expand and contract as you breathe in and exhale. And then the lungs are filled with this fluid called surfactant. And so when a baby is growing in the womb, the lungs are filled with this fluid. It's actually amniotic fluid. And so what happens is, as soon as the baby is born, it starts switching. So it's basically, when it's in the womb, it's drinking like all of this amniotic fluid. But once it takes birth, then it switches to being filled with air. So that's a really important process that happens within 10 seconds of birth. That's another little tie-in too. And like I was saying, another one of the fluids that the lungs produce is called surfactant. And what that basically does is it makes it easier for the lungs, for the alveoli to open and close. If you don't have enough surfactant, then your alveoli don't work very well, and then you can't breathe as well. So go to the next slide now. So now, Daniel kind of mentioned this before when he was speaking, but we're going to talk a little bit more about the pathway that air takes as you breathe. So what happens is you breathe in through your nose or through your mouth, and then the air is going to travel through your trachea down into your lungs. And so basically what happens is when you breathe in, your diaphragm flattens. And what that does is it creates more space for your lungs to expand. And that's what's happening basically. So every time you're breathing in, your diaphragm moves down and then your lungs expand. So the air is going to go through your trachea, and then it's going to divide into two bronchi, the left bronchi and the right bronchi. And the bronchi are going to divide further into bronchioles, and eventually they're going to turn into alveoli. And so that's what that picture is showing you on the right side of your screen. You can see the bronchioles dividing into alveoli, which are those tiny sac structures. And then what's happening at the level of the alveoli is that oxygen is being added to the blood and carbon dioxide is being removed. So your body is producing carbon dioxide when it's metabolizing fuel. And so you need to get rid of that waste, and your lungs are the site for that exchange. So yeah, that's sort of the pathway that air is going to take.
Hi guys, hope you guys doing well. So we're gonna talk about how COVID-19 affects the lungs. So here you have pictures of the different diagrams of like healthy alveoles, affected, moderate, and severe. So essentially, COVID-19 enters through like the mouth, nose, and eyes, which is why like you should not really touch your face or eat without washing your hands. So once it once it enters through those three pathways, it will try to make its way down the trachea to the alveoles, and essentially it will try to bind to the alveoli cells and try to enter through like, so there's two type of cells with alveoles. There's a type 1 cell and type 2. So the type 1 cell is like a thinner cell, which allows like oxygen to like pass through. And then the type 2 cell is a cell that secretes the surfactant, which prevents the collapse of the alveoli. So it will bind to the type 2 cell and inject its RNA, and the RNA essentially hijacks the cell and tells the cell to produce more of the virus. And eventually, the cell will die out or burst, and releasing more of the virus to infect more healthy cells, and it just keeps on going and going on. So in the on this page as well, it has like the immune responses. So basically, at the start of the infection, the type 2 cells release like an inflammatory signal, which recruits the immune cells and macrophages, and they release cytokines that cause vasodilation, which then allows more immune cells to come to the site of infection. And at that point, you're staying at home. Symptoms would be like a dry cough, a fever. Step 3, the fluid accumulates inside the alveolus, which is when pneumonia happens. And then the fluid dilates the surfactant, which then triggers the collapse of the alveoli. And that's when you start having like shortness of breath or like problems breathing. Then the neutrophilus is recruited to the site of infection, and then at that point you're hospitalized. And then as the further goes on, the cells are being more rapidly destroyed, which leads to more collapsing, and leads to the acute respiratory distress syndrome, and that's when you're in intensive care. You're in the intensive care unit, and then as it continues further on, you're more and more likely to face death. And yeah, essentially it just impairs gas exchange, and then leads to like oxygen deprivation of certain parts of your body. And yeah, that's basically it.
Hi, everyone. This is Maria. I hope you're all doing well and staying safe. Now that we have an idea of what COVID does to the respiratory system, what can you do on your end? So since there isn't a proven treatment, effective treatment or vaccine, the most effective way to slow down the spread of the virus is through social distancing, which means staying at least 6 feet away from other people that you are not currently living with. It also means wearing a mask every time that you go outside. That helps prevent transmission from asymptomatic carriers, people that may be carrying the virus without manifesting any symptoms, and continue doing that until your local government gives you further guidelines on that. Another way to protect yourself is to stay healthy. I know it's really difficult right now, but trying to stay away from the junk food, try not to make as many trips to the fridge. If you can, try to eat healthier snacks, make healthier choices, try to incorporate some exercise into your routine, and get an adequate amount of sleep. It can be really easy to just stay up really late and watch Netflix. But even though our schedules are really unstructured right now, it's important to have some semblance of a normal structured schedule and get an adequate amount of sleep. You can also stay informed. The internet has a lot of information out there that may not be accurate. So if you do want to learn more about COVID, make sure you check out reputable sources like the WHO, the CDC, Illinois Department of Public Health. Those are some websites that can give you further information that are reputable sources and not just people speaking their minds on the internet. And finally, you can donate either your time or money if you have the financial flexibility. There are many ways that you can help. You can volunteer by delivering food to people that are in need, helping local businesses stay afloat, making sure that people in your community that may be more vulnerable are getting the assistance that they need.
All right. Well, thank you for watching. And med students, would you like to add anything?
I think we're good.
No?
Yeah,
All right.
everyone did a great
Well,
job. Everyone did a great job.
All right. Well, stay safe, stay home, be healthy. Yeah.